Hi, I'm Dr. Miner. Today I'm here with a patient that has come in complaining of a migraine and telling me it's been going on since Wednesday. Is that right?
Yes.
Which now today it's Monday. So that's 4 or 5 days it's been going on. And tell us where that headache is.
It's right directly behind my eyes, but it starts from here going up into the back of my eyeballs.
So what we're going to do is we're going to do trigger point injections to get rid of this headache and get this patient feeling good. So the first thing I'm going to do is an evaluation. So about 80 to 90% of the time, these headaches and migraines are muscle related, but yet they're looked at less than 10 or 15% of the time. And so as I do this evaluation, she's going to let us know where these spots are that are triggering her migraine. And we will know that by her facial expressions. Okay, so I'm going to start feeling these muscles on her, and I have a marker that as we find these spots, I'm just going to put a little dot. So we're going to start. So most of what she said is on this side, but we are going to check a few things on that side. So we're just going to start here. What is it?
Yep.
Oh, sorry.
Mhm.
Is that worse?
Mhm.
Oh, is that
Yes.
the worst?
Yes.
Right there. Okay. So we're just going to mark that. Let's see, go back a little further. Anything back here?
Right there. Yep.
Right there?
Mhm.
Okay. Mark that. And she's also talked about her shoulder, which a lot of it's coming from here, radiating up. So I'm just going to feel in here on her shoulder.
Right there.
Is that the worst?
Right there.
That's worse? Right there? Let's put a dot. Is that worse?
It hurts, but it's not
Not
the
as bad
worst.
as the other
No.
one? Okay. And one thing that's common is a muscle in the neck will often radiate pain across the face and to the other side, which that's this muscle here. And so if I get hold of this,
Yeah, that hurts.
and, okay,
The lower one hurt the worst.
down in there, okay, right in there, is that it? Okay, so we'll place a dot there. Okay, we'll see this side. She was saying this side's not too bad, but how's that?
That one hurt.
Oh, hurts? Is that worse?
That one is. That lower one.
Right here?
Mhm.
Okay. We'll put our dot there. Anything back here?
Nope.
Nope. Okay, what about over here? Is it as bad as the other side?
No. Right there.
Is that it? Okay. Is that it? Not too much there? Just a little tender, but main spot right there. Okay. All right, so we have several dots, and we are going to do trigger point injections for those and get this headache taken care of. All right, so we're ready to do our trigger point injections, which oftentimes some people might refer to this as dry needling. However, with us, we use anesthetics, so it's not really what they call dry. I guess you could say it's wet needling. But the anesthetic makes it very comfortable, and we're going to use appropriate size needles, which the far majority of time when this is done, the needles are too small. They'll use more like acupuncture size needles, which actually this muscle can be so tight that with an acupuncture needle, it can, because they're so small, it can deflect around the spot we want to treat. And so for up here, we're going to use, this is one of our Botox needles. We don't have any Botox in this. And what we want to do is find that spot that is really creating the soreness, which is we find it, she lets us know. And then we put a little anesthetic there, and it feels and the pain starts going away. So a little pinch here. Okay, so I want you to know when you feel anything there.
Mm-hmm.
That kind of pinchy?
Mm-hmm.
Okay, so I'm going to do a little anesthetic there. And have a little stinging. Okay, now we're going to just address this. So the needle is actually doing the work for us. We want to kind of help break up this muscle so that it starts some healing and some inflammation. And do you feel anything?
Mm-mm.
Is it numb?
Mm-hmm.
Yep, so it's numb, very comfortable. And so a little bit there. We'll do a little anesthetic right there. Okay. All right, so we're going to do the shoulder muscle here. And the shoulder muscle is a big muscle, and so we're going to use a pretty good sized needle for that, which you might think it's uncomfortable, but it's really not that bad. So, and we want to find the spot in the muscle that's contributing to the headache and migraine. And so we're going to kind of move the needle around, and usually once we find it, the patient lets us know we found it. So, okay, first we're going to have this little pinch here. Okay, I'm going to put just a little anesthetic right there. Feel that?
Yes, I do.
Okay, so I'm going to let that anesthetic kick in. Give it just a minute. And then we're going to kind of go down.
Yep, that's the spot.
That's the spot right there? Okay. So I'm going to put a little more anesthetic there. We're going to numb that up really good. Okay. So with the treatment for this is actually what we do with the needle. And so it's not the anesthetic. The anesthetic just makes it comfortable. And so what we want to do is break up this muscle so that we can get some healing going. The muscle starts to relax. And a little bit right there.
Yep.
Okay, so there's another spot. We're going to do a little anesthetic. So again, this is very comfortable for her. She just lets me know with that. So these muscles are so tight. Again, if we didn't use the proper size needle, the needle would just go around it because the muscle's so tight. So and I can feel the tightness of the muscle with this, and I would suspect that I can feel it right there. That's a good spot. A little more anesthetic. That I would suspect that as we do this, she would probably start to notice her headache is starting to go away. Mm-hmm. Is that the case? Or?
Yes.
Okay, so where was the headache when we started? What number, like 1 to 10?
A 10.
A 10? Okay, and where is it now?
More like a 5.
A 5, okay. So we've gotten halfway, which is great. So I would suspect that at a 5 you could probably have pretty close to a normal day, almost.
Right there.
A little bit. Right there? Okay. So somebody that gets these migraines quite often, we can add Botox in here and get a longer lasting result. So we got all done with doing the trigger point injections. We did in the shoulder, up in here, we did this spot in her neck, and also over here in her head. And she came in from work saying she was having some trouble. Tell me a little bit about that.
So this morning I woke up and just was not able to even like open my eyes because the migraine hurt so bad. and I couldn't concentrate at work. So I came in to get this done, and now it's 10 times better.
Okay. So you think you could go back to work and have a normal day?
Absolutely. I can go back to work and be able to stare at a computer screen without wanting to cry.
Okay, so this took us probably about 15-20 minutes, and headache's gone, and she can have a normal day.
Yes, I can.
All right.